Hello, welcome to the Phoenix City Council meeting for June 16th. Thank you all for joining us. I will call the meeting to order and we will begin with roll call.
Councilman DeCiccio?
Here.
Councilmember Garcia?
Here.
Councilman Nowakowski? Councilwoman Pastor?
Here.
Councilwoman Stark?
Here.
Councilman Waring?
Here.
Councilwoman Williams?
Here.
Vice Mayor Guardado?
Here.
And Mayor Gallego.
Here. Thank you all for joining us. We will begin with council information and follow-up requests. Council members, any? Okay, I do not see or hear any council members with information or follow-up requests. Is that accurate?
Mayor, this is Councilwoman Pastor.
Go ahead, Councilwoman Pastor.
I just want to thank my D4 team for being out on Saturday at the march, passing out census information and really pushing to get everybody counted. So want to thank my D4 team. Thank you.
Thank you and the D4 team. That's so important. All right, Vice Mayor, do we have a call for an executive session?
Yes, we do, Mayor. In accordance with the property posted notice and agenda, I move that the City Council, pursuant to Arizona Revised Statutes Section 38-431-03A, change the start time of the Tuesday, June 23rd, 2020 executive session from 1 p.m. to noon.
Second.
We have a motion and a second. All those in favor, please say aye.
Aye.
Aye. Any opposed? Passes unanimously. City Manager, do you have any reports or budget updates you'd like to share?
Thank you, Mayor, members of the council. So tomorrow is the final budget vote for the 2020-2021 budget. The revenue numbers have started to come in from the state of Arizona, and our budget and research staff is taking a look at those. So far, it looks as if they are consistent with our projections, and I can also report that our city employees have done a good job in holding expenses so that we are very comfortable that we are going to meet the expense reduction that we committed to in March of $15 million, and so we have a good start on that as well. We will have a more full report on this tomorrow with the final budget vote, and then again on June 30th. Thank you, Mayor.
Thank you. We'll next go to our COVID-19 pandemic update and an update on the city's response to COVID-19. We'll begin by introducing our Assistant City Manager, Milton Dehoney.
Thank you, Mayor. Good afternoon, Mayor, members of council. I'm here to give an update on our COVID-19 response. I'm going to be talking specifically about our testing update today. So you will recall that employees are going through testing at Banner Health. To date, we have had 823 employees take the PCR test, more commonly referred to as the swab test, and 402 employees have taken the antibody test for a total of 1,225 employees. We have also been doing some testing at some of our public housing developments, Matthew Henson, Arrow Terra, Maryville Parkway Terrace, and Pine Towers. To date, 200 individuals have taken advantage of the opportunity to be tested there. We have just completed our partnership with Sonora Quest that was doing community testing at Steele Indian School Park, and over the 3-week period they tested a number of 307 people. And so next up is Desert West. both this Saturday, which is Father's Day weekend, and the following Saturday, 6 to 11 a.m. Our clinical partner is Equality Health. No insurance is needed, nor is ID needed, but you do need an appointment. So individuals can either call the number or go through the portal. This is a flyer that's been developed by our clinical partner and is being circulated around in order to gain more public awareness. Reminder that the census van will also be present on Saturday in order to encourage participation in the census process. And as we are doing that, we also have a commitment to do testing at Metro Center Mall parking lot. Our clinical partner there is Family Tree Healthcare. We actually have staff members from both the city and Family Tree on site as I sit here. We're going to be using an area of the parking lot that's adjacent to Dillard's and Dillard's parking. We will be announcing the dates for the testing at that location within a few days as soon as everything gets ironed out. In addition to that, we will be doing, still with our clinical partner, Family Tree Healthcare, we will be doing a drive-through testing at El Prado Park on 19th Avenue. We are also slated to do another pop-up testing operation at El Reposo Park on West Monte Vista Road. Dates for those two sites will be announced shortly. Additionally, we will be doing testing at Cesar Chavez Library parking lot. The clinical partner there will be Valle del Sol. This is an opportunity that was developed by Councilmember Garcia's office. And in addition, we are also working on expanding our reach around the city with the development of a mobile testing option. We have been in discussions with Circle the City and Linda Ross. I'll be coming back to you with more detail, but what we are envisioning is there would be a dedicated vehicle that would be properly equipped for testing. We would be able to move into different locations. The city would certainly help with the marketing to make the designated area aware that the testing would be coming their way. And so more details to follow on that. And that concludes my testing update for you this afternoon. Are there any questions?
Wonderful. Thank you so much for that update and such a great level of investment from the city. I really appreciate city staff being so responsive to council members' requests, from Councilwoman Williams saying, let's go to Metro Center, our West Side Council people saying, let's go west, to Councilmember Garcia, and the great partnership that you just announced. So Councilmember Garcia, floor is yours.
Thank you so much, and thank you for the update. I had questions around our employee testing. Those numbers seem to be a little low. Wondering if that's lack of knowing that these events are happening, or if that's just the folks that are coming in. And one of the things that I noticed as I was being tested this week is there a possibility for family members or employees, people that may live with employees, that we can add those folks, and what would that take? And that takes me to kind of the next question. Where are we at with budget in regards to testing? I think we all realize just in the last 24 hours, we have 2,400 new cases in Arizona. We've been in the news. We're the epicenter of this now. And so I just kind of would appreciate some of that information, and knowing that we have some unallocated monies. Is there something else that we could be doing to making sure that more people are tested, especially as the governor continues to reopen, and in my point of view, being a little irresponsible? I'm wondering what else we can do as a city particularly with testing and PPEs. I know I said a lot, but
Thank you, Mayor, members of council, Councilmember Garcia. So the numbers for city employee testing simply reflect the employees that have been tested to date. So the numbers that I showed you on the screen, that was as of this morning. Testing continues to go on daily. Additionally, there are some employees that are choosing to get tested elsewhere. Some of them have spouses that have testing options through their employer, and some employees are doing that. At the same time, as you know, testing is not mandatory, but we are continuing to push out the encouragement of testing and making it available. Also, given the way the pandemic has evolved, multiple testing of a single individual may be something that we continue to see going forward. The city manager within just this week has established a standard for mask wearing that you were alluding to. And so initially we were only having masks worn within aviation and convention center because their industries were requiring it. Now we're asking all city employees to wear a mask, particularly if you cannot adhere to social distancing requirements. And we're just within a couple of days of doing that. I'm not in a position this afternoon to tell you exactly how much money we have spent covering the testing through Banner. That's something that's covered by our insurance, but I'll be glad to check with HR Director Lori Bays and get some numbers for you. Our testing in the broader community to date has been fairly minimal because we didn't really have to spend much money for the Sonora Quest. The city provides a lot of the logistics sort of in kind, so equipment, we may already have it and we provide it. We are providing some out-of-pocket costs for some of the different clinical partners. And it's a good opportunity for me to remind you that essentially this is unfolding in a two-step process. So when I come to you on a Tuesday afternoon, I'm talking to you about what has been arranged or negotiated. The agreement solidifying that will come to you on a formal docket that trails my giving you advance notice of where we're going. And so the additional details and numbers will be provided sort of in an ongoing manner. And I think I've touched on everything that you said.
The one issue, Councilmember, the issue of family members in addition to city employees, we are talking, the HR director and city management have been working together because I think that is a good idea. There's no distinction in your home between you as a city employee and all the people who live with you. So if there's a way we can figure out to do that, we want to do that. That's a good suggestion.
thank you. And again, that's to keep everyone safe. If someone goes home and someone there is tested positive, then we don't want them coming back. And obviously we know where that's going. But yeah, I appreciate that. I just, again, there's an urgency after this last week that comes to us that I think we need to remain flexible and be able to move quickly. I think testing and PPEs is what we have right now. And so, yeah, anything that we can do to support anything, there's more funds that need to be allocated, or if we need to do more outreach on our side, please let us know.
If I could just follow up on that, Mayor, members of council, Councilmember Garcia. One of the items that we have to work through, if you notice when we go through and we're identifying who our clinical partners are, they tend to be organizations that are more community-based or smaller. They're not the major hospital chains, et cetera. So these places do not have unlimited staff, And so we have to work within their ability to provide crews to go to the sites and do the testing. They certainly are willing to do it, and we're willing to cover their cost, but there's also a head count situation that they have to manage through while they're still providing service at their headquarter location, if you will.
Thank you, Milton. Councilwoman Pastor.
I appreciate the numbers and everything, but as you stated, Milton, there are other smaller community partners. And my question to that is, how are you gathering that data or those numbers of those employees being tested and putting it in the data that you currently have? Because some of those small partners, people were able to get into because the larger ones are requiring appointments and they're not able to get into those areas, so they're going to the smaller ones. And my whole thing is about gathering the data to have a true reflection of how many employees are getting tested and who has tested positive or not.
Mayor, members of council, Councilmember Pastor, so in terms of the data or numbers coming from the testing, we are notified by Banner on the number of employees that are being tested. We also are given the percentages of those tests that are positive. That's just not a statistic I have been reporting out at these meetings. Also, when we formulate a partnership with a clinical partner for community testing, they do give us data after each round of testing that lets us know the percentage of or number of tests that were positive, but not the individuals. Part of the way that we have to arrange it in order to make sure that we're HIPAA compliant, we don't have any information on individuals, et cetera. The notification is handled solely by the clinical partner. All they give us is raw data as to this is how many people showed up on this date. These are the numbers of positive tests that we saw on this date. And so we capture it that way. To your point about larger systems that are doing testing, we don't get that for purposes of my report out here, but we do get those numbers rolled up in aggregate every morning when we get the data from across the state and across the county, and also as it boils down to the city of Phoenix in general. If you would like me to start identifying numbers of positive tests from our individual partners, I can start doing that.
I guess what I'm asking is that data really reflective of all our employee testing? Because for example, me, I didn't go to Banner and I didn't go to the state fairgrounds. I went to one of our smaller partners and got tested. So my question is that showing up in the data of demonstrating she tested negative? Is it showing in that aggregate, or are we collecting that number? Because there are a number of people going to smaller community doctors.
So, Mayor, members of council, Councilmember Pastor, if you, as a city employee, are tested through another entity that's not Banner, then you would be captured in the number of tests. If it's someone that we have a partnership with, we wouldn't necessarily know that of the number they're giving us, X number were city employees. We wouldn't know that. We do know it for Banner. We don't know it for any of our community partners. And as I indicated earlier, we are also aware that we have some city employees that are being tested through their spouses testing option, and we don't really know anything about that.
Okay, so then we don't really have a true reflective of how many employees are being tested then. We just have what we have with Banner and Sonora Quest. That's what I'm hearing.
We have what we
Okay.
have with Banner. We do not have it for Sonora Quest. We have it with Banner, but if you went to any of the other opportunities for testing, they're simply providing us raw numbers. They're not delineating of the number 200, 4 people were city employees. They're not doing that.
Thank you.
Thank you, Councilwoman. We do have one member of the public wishing to address the council on agenda item number 1. I'm not sure which portion of the presentation, so I'm going to go ahead and take him now. Philip Turner, the floor is yours.
Okay, you can hear me well?
We can hear you, yes.
Oh, great. I just wanted to make a comment about this. I've been sort of following it, all the information, and also what's been in the media about Arizona and Phoenix. And I was going to make just a suggestion, and I mean, a lot of people know better than I do, but I'm just an ordinary lawyer. You know, I was thinking that it's almost impossible to require people to do certain things, like make them wear masks and things like that. And you get into all sorts of situations with the police and having the police to try to do things that they're really not equipped to do. And one thing that I think might help is if we had more public service announcements by elected officials. And I think that perhaps the media would be willing to give that free space so that public service announcements can be made. And I think that is true leadership when you make those kind of public service announcements and you urge people to wear masks, and that you know, that will help a lot. I think the policy of trying to require people to stay home, it's an unrealistic policy, and it won't work in the long run. And some people just can't stay home because they have to feed their families. They just can't. But I think if we have public service announcements where public officials like the mayor and various people make announcements, and that is real life, live announcements on television and the radio saying, wear a mask because this protects you and it protects other people, and it will help us solve these problems. I have followed the comments by various public officials, elected officials. For example, I saw former Mayor Stanton make comments, and I've heard other public officials make comments. And a lot of these comments are, quite frankly, saying that, for example, the governor or somebody else is not exerting leadership, and just things that are negative comments about somebody else. And I think that's completely unhelpful, and quite frankly, I think it's counterproductive to do that. I don't think that's real leadership. The real leadership is to give a positive message to convince the people. And show the people that it's something that we should do. You know, for example, to throw a comment about somebody else and say somebody's irresponsible, the only thing that is, in my opinion, a verbal punch to somebody.
Thank you so much for your testimony. Appreciate the comments. I think there have been several members of this council who've been out trying to promote masks and how important there are. In my own post yesterday, I did receive negative comments about my fashion sense, but people were glad that I was wearing a mask. But there was some concern, given the size of my mask, that apparently I had stolen it from Shaquille O'Neal, and I would like to share with you. I have not, but we are trying to do that, and had a great conversation this morning with some of our sports teams who are willing to help post pictures of players and coaches wearing masks, which I think can also be helpful because there are so many different role models in our community. Some people look to our athletes, some people look to our elected officials, but I think masking is important and would encourage everyone to participate in it. So thank you. With that, we will turn next to our Deputy City Manager, Mario Paniagua, for an update on transit.
Yes, thank you, Mayor, and good afternoon, Mayor and members of the council. That's a great segue into our next discussion about what we're doing with public transit. And since also with me is Jesus Sapien, the Public Transit Director, to discuss this. So since the onset of the COVID-19 pandemic in Arizona, the Public Transit Department has taken several proactive steps to help reduce the spread of COVID-19 on public transit. These steps, such as substantially enhanced cleanings and distribution of personal protective equipment to employees, as well as bus passenger limits, rear door boarding, onboard sanitizer being available to passengers, installation of temporary bus operator safety shields, all have helped further protect our bus operators and passengers and are intended to slow the spread of COVID in our community. Staff is also working and receiving proposals on an RFP for permanent operator safety shields that can be retrofit on our bus fleet to ensure long-term protection is in place. The city has also made some service adjustments which have allowed the deployment of drivers and buses where they're most needed. One example of that is our assistance with transporting individuals experiencing homelessness to our convention center for heat relief efforts during COVID-19. However, in recent weeks, there's been a significant rise in the COVID-19 cases in Arizona and Maricopa County. As has been mentioned today already, this is underscored by the record rise in cases today in the state. This trend shows us we need to implement further measures on public transit. Based on some well-established guidance by the CDC and the medical community, the wearing of face coverings in public settings where it is difficult to adequately distance to help slow the spread of COVID-19 is essential. Even with social distancing guidance, it's difficult and can sometimes even be impossible for transit riders to remain adequately distanced from one another. And based on this, staff today is requesting council approval to implement a requirement for both operators and passengers to wear a face covering while using public transit. And with that, I'm going to turn it over to Jesus to cover some additional information about the recommended policy.
Thank you, Mario. Good afternoon, Mayor, members of the council. Thank you for having us back at the table to let you know how things are going relative to public transit in Phoenix. As Mario correctly states, we're here to talk to you about implementing a policy requiring face coverings on transit. So, as mentioned, it follows current CDC guidance for those out in public. The CDC does outline exemptions. Just some examples here are children under 2, individuals with a disability, or anyone advised by a medical professional not to wear a face covering because of their personal health issues. What we would inform the public of is that we would allow for various types of face coverings, such as masks, face shields. There's options for homemade cloth coverings that the CDC provide guidance on their website and good videos. We would also allow bandanas, scarves, or other cloth positioned over the mouth and nose. The other thing that we would do is that we would monitor the results of a similar discussion going on later this week at the Valley Metro Board, whereby they would also have a discussion on implementing the requirement for a face covering on regional transit, not just for Phoenix. The other thing that we would want to talk about is transit operators in the region would not prevent riders who do not have a face covering from boarding and riding. Transit and security staff will be involved in educating and encouraging individuals to wear face coverings while riding public transit. Law enforcement would not be involved in enforcing the wearing of face coverings on public transit, and not wearing a face mask on public transit would not provide grounds to stop, detain, cite, or arrest or prosecute an individual who is not utilizing a face mask of any sort. So what we wanted to do is seek council's approval to implement a face covering requirement on public transit. We would look to have that begin Monday, July 6th. And what that does is it gives us sufficient time to conduct significant public outreach so that we can notify our passengers of the policy change. What it would also do is allow us to activate certain transit centers, as well as work with other city departments for any facilities and programs they might have up and running where they could assist us in distributing available masks in advance of the policy implementation. So with that, we would seek, Mayor and Council, your approval to implement this face covering requirement beginning Monday, July 6th. And between now and then, as a department, as well as with our regional partners, if it ends up being a similar discussion and approval at the Valley Metro meeting later this week, we would work with them to roll out similar measures region-wide. And with that, we will take any questions.
Wonderful, thank you. Councilmember Garcia.
Yeah, my question, I think, Mario, I asked this earlier. Are we going to be able to provide masks to the bus riders? Unfortunately, and I think we had this conversation with a lot of the folks that we end up having, I won't say, you know, that we're influencing their lives, whether it's the pools not being able to open or the bus riders. It's a lot of low-income communities. And that's, you know, some of the things we've had to shut down in the last couple of months. But are we going to be able to provide masks? Are we going to be able to support folks in being able to have masks either on the bus or on the bus stops or at Phoenix, you know, at our whatever places we have open, whether it's downtown or our community centers or wherever? Are we going to be able to make masks available?
Mayor and Councilman Garcia, yes, thank you very much for that question. Jesus referred to a little bit about what we're planning in terms of making those masks available, even beginning before the policy is implemented. We would start with our transit centers, and we're working with other city departments to look at distributing masks at other city facilities where we can. We can make those masks and face coverings available. So that is the plan, that we would begin to make those available at those various locations for people to get masks, face coverings distributed so that they can participate and ride transit with that face covering.
Would we be able to do that by Monday when we would start? Would we have a plan in that short of period of time?
Councilman, yes, we're looking at beginning that on Monday, the 29th, to begin that effort with the mask distribution, and then Monday, July 6th would be the date that we're recommending to make the requirement effective on transit. So it'd be a week ahead of time, and then from there forth, we would be providing those masks and making them available.
If it's okay with you, Mayor, I motion to pass a recommendation of the mask being worn on the buses.
Wonderful.
Second.
We have a motion and a second from both the Vice Mayor and Councilwoman Pastor. Thank you. I think this is a responsible policy that will help protect our drivers and our riders. Councilwoman Pastor.
I wanted to know, I heard about the mask, but what I wanted to know is the date. I would like to make a friendly amendment to move up the date due to the fact of where we are today. And if we can move sooner than later, we could protect more people in the public. So instead of July 6th, I would like to move it up further. My question to Mario is there an issue with that?
Mayor, Councilwoman Pastor, the date could certainly be moved up to make that requirement effective sooner. The challenge is it leaves less time for the public awareness and our campaign to get that information out to the public. And as we were just talking about, it leaves a little less time to get some masks distributed ahead of time. And so that was part of the reason why we pushed out the date for the effectiveness. One of the things that we can do is, with our messaging right away, we could begin as soon as Monday, is let our passengers know, let the public know that this requirement is coming, and that it's changing from encouraging people to wear masks to requiring it. And so that's something that we could implement right away, even with the date out at July 6th. But again, we could implement sooner with those, knowing that those are the trade-offs. There'd be a little less time to get the word out, and a little less time to get masks out.
Well, I guess what I'm saying is that you can do a soft opening, and what I mean is like in the restaurant industry, there's a soft, so we start educating our riders, and then by July 6th, it is fully happening. My question also is the fact that I got an email from ATU, the bus drivers, saying that they want this mandatory. When yesterday I had a conversation and I was told that the bus drivers were okay with requiring it. So I'm a little confused as to what truly do the bus drivers, for protective reasons. I am one of, you are not required. It is in order for you to ride a bus, you have to wear a mask, and to ride the bus, if you don't have a mask, we will provide you the mask. So I think it's a public health issue right now for all of us, and all of us should start to be, not start, we've been concerned, but we are now at number one. And so as elected officials, I think we should start within our arena, be able then to require these items and really mandate that it happens. But I'm hearing that it's highly recommended.
Mayor and Councilwoman Pastor, today the policy is that we highly recommend, and that is our messaging. And what this change would be is that we're actually requiring. Now, we talked about in the presentation how that would be enforced, and so that would be about providing education about the policy, and the drivers would be involved in helping remind passengers about what the policy is and educating them. And so we also have been in discussions for some time with the union that represents those drivers, and I think that's the folks that reached out to you, it sounds like. And so my understanding is they're supportive of what we're recommending today, that they do want that to be a requirement, and understand completely why we're recommending what we are with the policy. And so that's my understanding. That may I'm not sure exactly where the difference is in what your email said.
The email states that they want everybody that enters the bus to be able to have a mask. It's not required. It is in order for you to enter the bus, you will have a mask.
So that's,
when I say require, that leaves it vague, because I could, okay, if we're going to use require, I don't have a mask. Am I allowed to get on the bus?
Councilwoman Pastor, under what we're recommending today, the policy would be that it's required, but we're not preventing passengers from boarding the bus or riding on the bus if there's a refusal to put a mask on. We do believe that for the most part, people will comply. So we will see a significant increase in the number of people wearing masks on the buses, and that's really our goal. And so we don't believe that taking those additional steps are going to be productive on our public transit in terms of denying people the ability to board on the bus. But that's where we're saying that our drivers can be involved in helping us educate and encourage passengers to wear those masks as the requirement states.
Okay, Mayor, can I make a final statement?
Please.
Well, in New York City, it's mandatory. So it's mandatory for them to wear masks. I think it's critical now because we're number one. And I feel like we need to prevent not only our bus drivers, but those in the public and those entering and riding public transit. So that's just me. Takes 5 votes. But what I would like to do is make a friendly amendment of pushing the date further up.
Councilwoman Pastor, this is Jesus with Public Transit. In doing our research, it's my understanding that New York is mandating it because of a state executive order. So I just wanted to give you that background information. My recollection is that it's not the transit authority mandating it, it's that they are operating under a state executive order, so they are able to, perhaps enforce a little differently because that's what they're operating under. So just wanted to give that background information relative to what's going on in New York.
So is the issue then enforcement? Is that what I'm hearing, Jesus? It's really about enforcement on our buses?
Mayor and Councilwoman Pastor, that's really the difference between what we're recommending today and what you're hearing in New York is they have an enforcement authority in place that requires, mandates people wear those masks on the bus, and if they're not, they're not allowed to ride, or if they refuse, they are the law enforcement authorities are involved, and we're not recommending that be part of our policy.
Councilmember, I will go, because Councilwoman Pastor recommended an adjustment to the motion, I will go to the maker of the motion, and then the Vice Mayor is next in the queue. Councilmember Garcia.
So I would only feel comfortable with that if we're able to get masks out earlier. I think this is more of a carrot rather than stick situation, and I would hate for our bus drivers to get into these situations, especially if we don't have available masks to folks. And so if we can move getting masks out there before, I would be totally fine. I just don't want people that don't have access to masks to then get, pushed. I know they're not going to get pushed out of the bus, but definitely this new expectation is going to be put out there. And if we can't get masks to people, then I wouldn't feel comfortable. So I would agree to it only if Mario, and as soon as we can move up, also getting masks and information out to the public.
Mayor, Councilman Garcia, we could certainly try to get the masks made available to the public sooner in terms of moving the date up, and we can work toward that. I'm looking at Jesus. We do have a supply of masks, face coverings on hand that we can make available to the public. We would also place an order a significant order for additional masks. But I think we could roll those out at our transit centers, that we have a window where staff can be behind the window to supply those masks. We could implement that on a sooner date, I believe.
Mayor, members of the council, yes. As Mario says, we did receive some masks from the FTA. So we have those in our office, and that would be the first contingent of masks that we could distribute. So we could certainly do that, to Councilmember Garcia's point, just recognizing that there may be somewhat of a little bit of a gap between when those run out and when we get more. As Mayor, members of the council, you have been aware, relative to PPE, there have been several impacts to the supply chains from various vendors. So we can certainly order a large quantity, and we can absolutely do our best to distribute them as they are available. Again, just recognizing that if the demand outstrips the supply, there may be times when we have some days when we're not able to distribute them simply because the supply chain is catching up.
Thank you. So I think then the motion now on the table would be to implement as soon as possible. And to me, also the communication, whether it be signs on the buses or other ways, hopefully in appropriate languages, is also very important, but the sooner we can start communicating the value of masks, the better from my perspective. Our very patient Vice Mayor now has the floor.
So my question is, I don't know if it's Jesus or Mario. One of the things, I mean, I am 100% in agreement that we should require folks to wear a mask when they're getting on the bus. But if we are going to be supplying masks for folks, how, like for example, if I live in Maryville and I catch the bus, I don't have a mask, and I'm catching the bus at 59th in Camelback, how is it that are we going to have masks on the bus? Is that what we're doing?
Mayor, Vice Mayor, we don't have the ability to safely distribute face coverings on every single bus. And so that's why we're very focused on getting the transit centers activated for mass distribution, as well as working with other city departments and using other city facilities as we can to use those facilities so that we have more locations where we can distribute those masks. We're just not able to get those on every single bus. We have quite a large fleet, a lot of routes, and that's not something that the drivers would be involved in, and so it's very challenging to get something in place where we have masks on every bus. And I don't know if Jesus would add anything to that.
Yes, Mayor, members of the council, thank you. The other thing I would note to Vice Mayor Guardado's question is that's why we're allowing several types of coverings, because we recognize that not everyone may have the ability to leave the house with a quote-unquote mask readily available. So as we have seen in other transit industries across the U.S., transit agencies, I should say, other types of face coverings are acceptable, and that is basically the guidance that CDC has been putting out for some time now. So in your scenario, Vice Mayor Guardado, perhaps if you left the house with some type of face covering, and then we would do our best to message to the public when and where we would be distributing actual masks, and then perhaps part of your ride could coordinate with one of those locations, such as Central Station downtown or Ed Pastor Transit Center, something like that. And as Mario correctly said earlier, we have begun the discussion with other departments that have programs or facilities that are currently open and staffed, where we might be able to take advantage of those staffing hours to help us with that distribution. And of course, the messaging to the public is going to be key to let folks know when and where a mask will be distributed.
Okay, yeah, just because my bigger point with that was that I just wanted to make sure that our drivers were not going to get stuck having to be a driver and then supplying masks at the same time. So yes, I would also appreciate the information given out to folks, and for us to be able to tell people from what time to what time they can collect the masks, the places where we're going to be supplying the masks. And also in this process, making sure that at no point do we make the drivers responsible for these masks either, right? Because we're also, trying to protect them as drivers and trying to protect the public. And we never want to put our drivers in a position where they have to be the enforcer on the bus either. So I would like to see what type of communication we're going to put out there, and making sure that we're able to supply masks to people and make it easy for people to be able to have access to the masks. Thank you, Mayor.
Thank you, Vice Mayor. Councilwoman Williams.
Vice Mayor made an excellent point. Are we going to have just places for them to dispose of the masks when they want to leave the bus or leave the platform? Because otherwise they're going to be scattered all over the bus or the street.
Mayor, members of the council, Councilwoman Williams, our buses do have a trash can on board. So if someone wants to dispose of their masks, they can do that. And as I believe you recall, our light rail platforms also have several amenities which include trash cans. I will note, however, for example, the masks that we were provided by the FTA through FEMA, they are cloth and reusable. So part of our messaging would be that if they are reusable, then certainly we're looking for individuals to reuse them. And again, the CDC provides really good information on their website about if you have a cloth mask, how to care for it, how long it can last, and how to wash them.
And those trash containers have a plastic liner so nobody has to touch any of the material?
Mayor, members of the council, Councilwoman Williams, I can't remember exactly, but I will certainly check into it. What I will tell you is the individuals who do maintenance and cleaning of the buses back at the yard are provided with PPE, so no one's touching those with their bare hands.
Okay, thank you.
Mayor?
Councilman DeCiccio.
Thank you, Mayor. Just so, I'll tell you, there's a bit of confusion here too. So I just want to make sure we're really clear. If somebody decides to get on a bus and says, I'm just not going to wear a mask, will that person be allowed to board the bus? It's a yes or no, Mario.
Mayor, Councilman DeCiccio, the answer is yes. They will be
Okay.
encouraged to wear a bus. They'll be educated on our policy. But at that point, and they'll be educated on the fact that they can obtain a mask and how to do that, but they will not be denied a ride.
So bottom line is what we're doing here is we're asking people in a nice way and in a firm way to wear a mask, but we're not requiring them to wear one. Correct?
Councilman DeCiccio, it's a requirement, but the way it's enforced is reliant really on that compliance of the individual.
Right. So they're being asked. So if they go into the airport and they're not wearing a mask, can they be kicked out of the airport?
Yes.
Okay. So they can be kicked out of the airport, but we've heard reports of people coughing on others and sneezing on others and all that in a very tight area. But if they go into the airport, they can be kicked out, but they can't be kicked out of the bus. Does anyone not see the hypocrisy here? I'm good with this policy because I think it leaves it up to the individual to make that decision. But I mean, it is a little bit hypocritical that we, in one area where it's wide open, we require individuals to wear a mask, but in tight, confined areas, they're really not required to do that because no one's going to do anything to them. So I'll be supportive of this because I think this is the way we should be doing it. And I'm glad it reaffirmed at least my belief structure that, we always encourage people. You just don't penalize people. And at the end of the day, it's individual choice. But there is a hypocritical side of this because if you look at what's happening at the airport where you can kick somebody out, you can't do it in a tight, confined area. Thank you, Mayor.
Mayor and Councilmember DeCiccio, what I would just say is I wouldn't define it as hypocritical. I think we're being realistic about our resources. We don't have resources to guarantee that we can patrol each bus because the bus operators need to spend their time safely operating the moving vehicle. We're not requiring the bus operators to enforce it, and we don't have enough security or other staff to be on each individual bus monitoring every person who gets on there. So I think what we're wanting to do is to be clear that we don't have the ability to absolutely enforce it. The difference at the airport is limited access points, and we have much more staff at the airport than we do to staff a bus. So that would be the difference in why we require it on a bus, but we don't have the resources to enforce it on every bus on every trip.
Mayor, just I'm going to push back a little bit on that, Ed, because if you don't even say you're going to require it, then they're not, then you essentially set in place that standard. It doesn't matter whether you have the employees there or not. The fact of the matter is it's either a requirement or it isn't. And that's where the hypocrisy comes into play. Like I said, I am good with this policy because it encourages people to do it. I'm just not a fan of requiring people to do things. I think there's a civil rights issue, at least from my end of it. But either way, it just reaffirms what I've been saying. It's not about the resources. Unless you say, hey, you definitely have to do this, then you're never going to get full compliance anyways. But thank you, Mayor.
Thank
Mayor?
you, Councilman Nowakowski.
Thank you, Mayor. Mayor, I know that we have a regional approach when it comes to busing. So are other cities going to be practicing the same? So if you get on the bus at Mesa or Tempe or on the west side, are they going to be required to wear masks also?
Mayor, Councilman Nowakowski, that's a great question. We are looking forward to an item on the Valley Metro Board this week. Our mayor represents the city of Phoenix on that board and has requested that an item be placed on that agenda for this week to enact that policy on regional transit. So all the other cities, as well as light rail, if this were approved by that board, then that would be the case, that the policy would be enacted region-wide.
And Mayor,
I
can I
should say,
follow up with a question?
Councilmember Heredia of Mesa joined me in the request to put the item on the agenda, and as the rail voting works for Valley Metro Light Rail, we then already constitute a majority of the votes. So I'm cautiously optimistic it will pass.
Perfect. And then Mayor, a follow-up question. Is that going to be a recommendation or a requirement at the Valley Metro or at the League at MAG?
I think it would be structured the way we have, where it is a requirement, but we would not have law enforcement arresting people who did not. I think we all learned from one of our other fellow cities that had a police involved with enforcing a masking requirement, and I think that did not contribute to increased public safety for our community. I see no further comments. We have a motion on the table. Roll call.
DeCiccio,
Yes.
Garcia,
Yes.
Nowakowski,
Yes.
Pastor,
Yes.
Stark,
Yes.
Waring,
Yes.
Williams,
Yes.
Guardado,
Yes.
Gallego.
Yes.
That motion passes unanimously, Mayor.
Wonderful. Thank you to all my colleagues. I hope that this will help slow the spread of COVID-19 in the city of Phoenix. We next move to an issue of considerable importance to this council and our community, affordable housing. I will turn it over to our Assistant City Manager, Deanna, to introduce the item and our speakers.
Thank you, Mayor, members of the council. We're pleased to be here today to present to you the Affordable Housing Initiative. This has been a work in progress, as you know, over the last year. The Housing Department, under the leadership of Cindy Stotler, has worked very hard to bring forward to you a solid plan that we think will be instrumental in the success of our city and some affordable initiatives. I will turn it over to Mario Paniagua to talk about the presentation initially.
Thank you very much, Deanna. Thank you, Mayor and Council. Once again, I appreciate the opportunity to be here to talk about the city's affordable housing issue and our draft plan and goals to address the substantial needs in our community. As you know, affordable housing ties closely with other important issues the City of Phoenix is working hard to improve, such as homelessness, racial equity, poverty, and overall quality of life. And improving the availability of affordable housing is something that you, Mayor, and members of this council have made a strong priority. In last year's budget, you approved a new position to add to the Housing Department's team to be our internal expert and help lead the way to new changes that can help close the gap. And along with our Housing Director, Cindy Stotler, the person hired for that job is here also to assist with the presentation, Sherry Boucher, and I'm glad to introduce her this afternoon. Cindy and Sherry will cover the Affordable Housing Initiative, and staff will be requesting council approval of the proposed plan. I'll now turn it over to Cindy Stotler.
Thank you, Mario. Good afternoon, Mayor and members of the council. We are very excited to be here today to present our work on the Affordable Housing Initiative. Affordable housing is of critical importance to a community's health and viability. The City of Phoenix is currently experiencing a significant shortage of affordable housing at most income levels. This problem has been growing for years and has been well documented by organizations like the National Low-Income Housing Coalition, the Urban Land Institute, Arizona State University, and the local media. We are seeing the results of this housing shortage in ever-increasing rent, home prices, and our growing homeless population. During the last year, we have conducted extensive research and community outreach to ensure a comprehensive report. The policies and strategies that we present to you today will establish the direction for future action the city will undertake to address the affordable housing shortage. The first product of this initiative is a comprehensive Housing Phoenix Plan, a draft copy of which was sent to you on June 5th and included in today's packet. This presentation highlights from that draft plan. I'm going to start with a review of the goals of the Affordable Housing Initiative. They were to identify the affordable housing need in our community, to identify existing housing and complete a gap analysis between available housing and the need for additional housing, to identify high opportunity future housing development sites, and to present policy recommendations to increase and incentivize affordable housing in Phoenix. To identify the housing need, we have to understand the housing market today. As we all know, Phoenix is a great place to live, and we continue to attract many new residents every year. In 2019, Phoenix was the fastest growing city in the United States. We now have about 1.7 million residents. The housing market has not grown at the same rate as the population, resulting in an overall housing shortage. This shortage is due to the severe underproduction of housing over the past several decades. This chart compares housing and population growth over the last 3 decades. You can see the number of housing units produced, shown in blue, have not kept pace with population growth, shown in orange. Notably, in the last decade on the chart, you can see that the housing production came to a virtual standstill during the Great Recession. In the last 30 years, Phoenix produced approximately 220,000 new housing units, while the population has grown by 820,000. This scarcity has caused housing costs to rise faster than most residents' income growth. Between 2010 and 2018, Phoenix median income increased by 10%, while median rent increased by over 28%, and median home price increased by over 57%. In order to determine the types of housing needed, we have to document income levels to see what residents can afford. Income levels are compared to area median income, or AMI, which is the midpoint of a region's income distribution. This is calculated annually by the U.S. Department of Housing and Urban Development. Our AMI is a regional calculation for the Phoenix metro area. Based on the most current census data, 46% of Phoenix residents are considered low to extremely low income, making less than 80% of area median income. 19% are considered low to moderate income, making just under, at, or over area median income. 35% are considered moderate to high income, making over 120% of area median income. In our current housing market, the 65% of households that fall within or below the moderate income range would require some amount of subsidy to achieve housing that is considered affordable at their income level. Affordable housing is defined as spending no more than 30% of your monthly income on housing and utility costs. Households paying more than 30% of their monthly income toward housing costs are considered cost-burdened. According to the most current census data, over 199,000 of the 555,000 total households in Phoenix are cost-burdened. These are the at-risk households that are often one paycheck or one unexpected bill away from losing their home. Most low-income households are renters, so it was no surprise that 50% of Phoenix renters are considered housing cost-burdened. However, that 25% of homeowners are housing cost burdened was surprising to us, as homeowners are generally the most financially stable households. Overall, 36% of the entire population is housing cost burdened. This graph provides a visual of the cost-burdened households by income range. As you can see, the lower income brackets have the highest percentage of households that are cost-burdened. This demonstrates a significant lack of affordable housing options for households in the lowest income brackets. This image provides a cross-section of households and their income ranges. A combination of household composition and total income determines the maximum affordable rent or mortgage for each household. For example, a senior on a fixed income of $15,000 per year would be considered extremely low income and would only be able to afford about $375 per month for rent. This would have to be some kind of subsidized or shared housing. A service industry worker making minimum wage can afford a maximum rent of $650 per month. The current average rent for a one-bedroom apartment in Phoenix is about $1,100 per month. A single parent with 2 children making $53,000 per year can afford a maximum rent of $1,325 per month or a mortgage of $171,000. According to Zillow, the current median home price in Phoenix is $248,000. The only income level that can afford to purchase a median home price are families that make 100% or more of area median income, which is $73,000 for a family of 4. The second goal of this initiative was a gap analysis to identify the need for housing compared to existing housing stock in Phoenix. The need was determined based on population and income levels, as we have just reviewed. The current housing stock was determined by using multiple data sources, including apartment insights, census data, information from affordable housing developers, and city departments. The gap analysis revealed that Phoenix currently has a need for 163,000 additional housing units. Of that, about 63,000 are regular market rate, and over 99,000 would need to be affordable and subsidized for households with lower income levels. This number includes approximately 9,000 units needed for seniors, 5,000 units for veterans, 9,000 units for persons with disabilities, and 1,400 units for unsheltered persons experiencing homelessness. As we've discussed these findings in our briefings with you and members of the community, we've often been asked, how is this housing shortage affecting people right now? Where are they living if we don't have enough housing? The answer is that many are homeless, on the street, in shelters, or in their cars. Others are living in overcrowded conditions, often in substandard housing, in the only areas of the city they can afford. Where people live matters. Research has shown that neighborhoods can be a good predictor of health and future opportunities for success. Poor housing quality in low-income neighborhoods can expose residents to toxic substances, leading to chronic disease and poor childhood development. Low-income neighborhoods may also lack standard amenities like shade, playgrounds, full-service grocery stores, and quality schools. Demographics vary greatly across Phoenix, with significant differences between neighborhoods. For example, the southern portion of the city has a significantly larger population of minorities. Residents in the south and west sides of Phoenix have lower than average incomes, more substandard housing, more underfunded and underperforming schools, and more food deserts. This map shows more cost-burdened households identified by dark pink and blue in the southern and western areas of Phoenix. This map shows the high concentration of white, non-Hispanic population represented in darker colors in the north and east areas of Phoenix. The white area in southern Phoenix has a greater than 83% concentration of minorities. This current disparity is consistent with the mortgage lending practices of the 1930s that redlined minority neighborhoods where lending was considered too risky. This lack of access to mortgage lending kept these residents from wealth-building mechanisms like establishing a credit history, building equity in a home, and passing home ownership on to future generations. This map shows redlining was concentrated in areas generally located south of Van Buren. Redlined areas include our Choice Neighborhoods community near 16th Street in Van Buren, with the highest concentration of public housing in the state. The areas of our city that were affected by redlining are still minority concentrated and impoverished today, more than 8 decades later. As we talk about building more housing, we need to look for ways to break this cycle and put more housing options in areas of opportunity. 163,000 new homes is a daunting and challenging number. To create this many homes, we will need to change the way we develop. We will need to build a variety of housing options for households at all income levels. Here in the Southwest, we have traditionally expanded using single-family development. However, if we were to build all 163,000 units using single-family development, we would need 31,000 acres of vacant land. The City of Phoenix currently has approximately 24,000 acres of vacant land, and that's all types, including industrial, commercial, and residential. Even if we rezoned all of it, there's not enough vacant land to develop using the single-family home model. It will be beneficial to educate our community on what alternative housing options will look like in the context of our existing neighborhoods. The city can make the most out of our remaining resources by developing in a more sustainable way, using a variety of housing models like townhomes, duplexes, and accessory dwelling units. The need is daunting, but it can be done. We will need some innovative and aggressive initiatives to help us get there. Before we continue and present our recommended initiatives to you, I'll take a break and ask if there are any questions. I have presented you with quite a bit of material, so we can take a break. Does anybody have any questions or follow-up?
Thank you, Cindy. Very timely and useful information. It's fabulous to have that all in one place and certainly shows a huge need. Council member, comments or questions? Councilman Nowakowski.
Thank you, Mayor. Mayor, first of all, I just want to thank you, Cindy, for our hard work and making this all possible and bringing affordable housing into the city of Phoenix. I know lately in downtown Phoenix, ever since I've been a council member for the last 13 years, we've seen a growth in housing in the downtown area, but a really lack of housing, affordable housing in that area. One of the things that we've been hearing about is the whole Davis-Bacon Act, and basically sometimes referred to or regard to as the prevailing wage. If that was inserted with all these numbers that you are giving us right now, would that affect the projections that you're giving us about the growth in the future?
Mayor, Councilman Nowakowski, members of the council, that's a very good question. Certainly the cost of development does affect the number of affordable housing units we can build. And Sherry will be talking about some cost reduction recommendations in her initiative recommendations. But cost is definitely one of the barriers to building more affordable housing. So anytime we add cost to affordable housing means we end up with less units.
Alrighty, thank you.
Vice Mayor. Vice Mayor, I think you are on mute.
Can you hear me now? Sorry.
Yes,
So I just wanted to say thank you so much, Cindy. I think this conversation is long overdue. I think we've been trying to do a lot. But I do want to say that I do believe that addressing the city housing affordability crisis is one of our most pressing issues, and one that I take very seriously. Given my background, given where I come from, I think that's something that's incredibly important for our city. I think the report is excellent. I think it was done very well. But one of the things that really drew my attention was to be able to see, the crisis that 43% of our population is in right now. And there are other points that I wanted to touch on and make sure that they don't get lost in the mix as we continue with this presentation. On connecting health and affordable housing, CJ Eisenbarth Hager of the Vitalist Health writes, prevailing rents that are out of proportion with prevailing wages create a complex mix that can lead to evictions and ultimately homelessness. I think that it's critical for all of us to grapple with that and to really try to figure out the desperate need that is out there, and how is it that our city can improve wages and protect the workers as well. If we create a housing strategy without a good job strategy, without a prevailing wage strategy or without worker protections, we will find ourselves again in this same place. And we will be looking at each other once again in 5 or 10 years. Why is it that we have so many people still experiencing homelessness? I think those two things go hand in hand, and we need to figure out a way, how do we tackle, how do we address both things at the same time? The other portion of this report that really stood out to me, like I said before, is that 46% of our residents are either extremely low or very low wages, low income. This only means that close to half of our city is struggling paycheck to paycheck. One of the things that I saw when I was knocking on doors a year ago, it's like you said earlier, most of the people are trying to figure out, are they going to pay their rent? Are they going to pay their bills? And health insurance, sometimes for a lot of these families, is not even something that's in their mind. It's something that if they don't have to pay for it, they won't, because they're always trying to figure out how is it that they're actually going to feed their families. So I feel like this report is shining the light on many of the inequalities that we don't like, and sometimes we don't like to talk about those things. I think it's incredibly important because this is what our community grapples with day in and day out. When we think about why is it that we don't have enough neighborhood associations, why is it that a lot of our residents are not really thinking about what's going on in their neighborhoods, is because they're working 2 or 3 different jobs. As long as we don't address this issue, it's going to continue to be a problem. And I think that we got to continue to talk about this issue. And I know that as a council, we'll definitely be able to figure it out, and we'll be able to bring good solutions. I am thankful for the staff that worked diligently on this report, especially our housing director, Cindy and Sherry Bouger. My office met with neighborhood advocates and stakeholders in the development community to provide feedback on this plan. We are happy to see it address many of their concerns and recommendations. Thank you also to the Arizona Multi-Housing Association for reaching out in support. And thank you, Mayor, for being such an advocate on this issue. I look forward to working together with all of you and making sure that we're able to find a solution to this crisis. Thank you.
Thank you. Councilmember Garcia.
Thank you, Mayor, and I couldn't agree more with the Vice Mayor. I think to somehow allude that if we pay workers more money, this isn't going to be possible is a little bit ridiculous. I think Davis Bacon, a federal policy and the possibility of a prevailing wage to assuring that the workers get what is right and that they could have more affordability, it actually goes hand in hand with this process. I want to thank Cindy for all the work. I think the historical context of redlining, again, are difficult conversations to have, but are important to understand the inequalities that we've lived generationally. I think the other part, and I think part of the work moving forward, is going to be involving community and making sure that I think the thing we all hear from our village planning committees or our neighborhoods is affordable housing is great, but what is that going to bring to my neighborhood? Is it going to lower my value? Is it going to bring, things such as crime or whatever? And I think we need to get rid of those stigmas and understand that affordable housing needs to happen, and it needs to happen across the city. Particularly, I think downtown is, with all the development we've seen, I think it's important to push downtown, but I think also making sure that affordable housing is available throughout the city is going to be important. And I think the way we get to a better place is obviously, I think pushing this plan, it's great, but also involving community and impacted folks to make sure that they're involved as we design and implement this process. So again, I'm really supportive and thankful for the work that you've done.
Thank you. And the Vice Mayor mentioned that we have heard from the AMA in support of this plan. My office heard from a wide variety of stakeholders, including Downtown Voices, the Phoenix Community Alliance, Valley of the Sun United Way, the Greater Phoenix Leadership Housing and Homelessness Committee, all in support of this plan. So broad group of stakeholders supporting the plan. With that, we will turn back to Cindy and her team.
Thank you, Mayor, members of the council. I'll turn it over to Sherry Boucher now to talk about our policy initiatives.
Thank you, Cindy. Mayor, members of the council, thank you so much for your time today. I'm excited to talk to you about some of our policy initiatives. As Cindy mentioned, all of the initiatives discussed today will be included in the Housing Phoenix Plan, which has an aggressive goal to create and preserve 50,000 homes by 2030. To meet this goal and increase overall supply of market, workforce, and affordable housing, we recommend the implementation of the following 9 policy initiatives. These policy initiatives include prioritizing new housing in areas of opportunity, amending current zoning ordinances, redevelopment of city-owned land, enhancing public-private partnerships and increasing funding, building innovations and cost-saving practices, increasing affordable housing developer representation, expanding efforts to preserve existing housing stock, supporting affordable housing legislation, and an education campaign. The first policy initiative is to prioritize new housing in areas of opportunity. An important finding of the Housing Phoenix Plan was that the city needs to prioritize housing near amenities, such as major transit corridors, quality education, employment opportunities, healthcare, and much more. We recommend that the city develop an objective, place-based scoring matrix for multifamily housing projects to allow decision makers to analyze their community benefit. The second initiative would amend current zoning ordinances to facilitate more housing options. In order to accommodate 163,000 units, we need a variety of housing types outside of the traditional multifamily and single-family options. To do this, we need to amend the current zoning ordinance to incentivize affordable housing and allow for additional uses like accessory dwelling units. Affordable housing incentives would provide developers with incentives if they build affordable housing or if they pay into an affordable housing fund. This would help generate non-federal funds for affordable housing development. Expanding the walkable urban code will create opportunities for more flexible infill development and adaptive reuse. It will also allow for a variety of housing types, such as townhomes, duplexes, and triplexes, which are commonly described as the missing middle between single-family and multifamily housing. The third policy initiative would redevelop city-owned land into mixed-income housing. Land in areas of opportunity would be identified and redeveloped through an RFP process. An innovative idea we've seen in other cities is the co-location of uses. This involves underutilized land which have current uses, such as community centers or senior centers, that could also accommodate a housing component. Once identified, a portion of these parcels would be redeveloped to include housing. The fourth initiative is to enhance public-private partnerships and increase funding options. There's a growing interest among public and private partners to assist and help solve the affordable housing crisis in our community. We recommend harnessing this interest through a creation of a group or task force. This group could also help identify and create new opportunities for financing affordable housing and target financing to areas of opportunity. The fifth initiative would build innovations and cost-saving practices for affordable housing development. With limited financing resources for affordable housing development, reducing costs will help minimize the subsidy needed per project and thus allow the community to create more units using less resources. Cost-saving practices can include a development team assignment, assigning affordable housing projects to a development team with experience in this field. We recommend a pilot project for low-income housing tax credit projects, which have strict federal and state requirements and deadlines. With increased specialization, the development process will be streamlined, which will help save time and money. Other recommendations include an affordable housing advocate, reducing planning and permitting fees, creating an infrastructure fund, and researching and implementing ongoing cost-saving practices. The sixth initiative recommends increasing affordable housing developer representation on boards, commissions, and committees. We've recently seen a number of affordable housing developers appointed, such as CPLC, Habitat for Humanity, and Trellis. We recommend continuing this trend, which will help include their perspective as development decisions are made. The seventh initiative would expand efforts to preserve existing housing stock. All of these preservation tactics can be targeted to areas that are subject to displacement or to prevent gentrification. Land banking is a strategy often used to prevent gentrification or eliminate blight. The Neighborhood Services Department utilizes this model to eliminate blight, but it can also be expanded to prevent gentrification through the preservation of existing affordable housing or the development of new affordable housing. The Community Land Trust model reduces the cost of homeownership by placing the land in a trust, only requiring the home buyer to mortgage the amount needed to purchase the home. The model creates opportunities for low-income households to participate in homeownership. Other recommendations include creating landlord incentives for the Section 8 program and expanding our rental rehabilitation program to preserve naturally occurring affordable housing. The eighth policy initiative would help support effective affordable housing legislation. Two state legislative items that have gained a lot of traction this year were the State Housing Trust Fund and the State Low-Income Housing Tax Credit Program. These items would increase funding for affordable housing, and the State Low-Income Housing Tax Credit Program is anticipated to create 6,000 more affordable housing units statewide on an annual basis. We recommend the city support federal and state legislative items that would increase funding and financing for affordable housing. And finally, the last policy initiative would create an education campaign. One of the major barriers many developers face is not in my backyard sentiment or NIMBYism. To help overcome NIMBYism, it's important to establish marketing materials that communicate our housing need and debunk existing myths. As we have seen, folks like our teachers and our service industry employees are in need of subsidized housing. These are residents that work really hard and give back to our community, but they have difficulty finding an affordable home in our city. It will also be beneficial to demonstrate and educate our community on what alternate housing options will look like in the context of their existing neighborhoods, and how the city can make the most out of our remaining resources by developing in a more sustainable way and with a variety of housing development models. Once these marketing materials are made, they'll be used to educate our community on an ongoing basis. We are recommending council approval of the affordable housing initiatives described in the draft Housing Phoenix Plan, and once approved, we'll finalize and publish the Housing Phoenix Plan and begin implementation with internal, external stakeholders and community members. Thank you.
Thank you so much.
Mayor?
Vice Mayor.
Yeah, so I would like to make a motion to approve.
I will second.
Second.
So I think we have a motion from the Vice Mayor, and I think I heard Councilwoman Stark first. We do have 5 members of the public who are quite involved in housing available to testify. So I think if it works with my colleagues, I will go to the phone and hear from people with considerable expertise in this area. We will begin with Joanna Carr, followed by Katie Aries.
Can you hear me?
Yes, we can.
Hi, Mayor and council members. Thank you for your time in considering this incredibly important initiative. My name is Joanna Khan. I'm the Policy and Research Director for the Arizona Housing Coalition. I'm speaking on behalf of our organization and our 219 individual and organizational members that are working to address homelessness and the shortage of affordable housing within our city and state. This affordable housing initiative is a vital strategy for our city, which is in the midst of an undeniable affordable housing crisis, a crisis which has and will continue to be exacerbated by the current COVID-19 pandemic. For far too long now, we have seen year-on-year increases in the numbers of individuals and families who are homeless in the city and have witnessed a crisis on our streets as the number of those experiencing street living is undeniably growing. Dedicated staff within organizations and services across Phoenix are working tirelessly to address this issue in efforts to move individuals and families out of homelessness and into safe, secure, and affordable housing. Oftentimes, this feels like a losing battle. There's simply not enough affordable housing. A lack of affordable housing is inextricably linked to poor health outcomes, poverty, low educational attainment, job insecurity, and many other factors that prevent individuals from thriving and succeeding in their lives and in our local economy. We must give recognition to the significant structural disadvantages of historic and existing policies imposed on communities of color and other marginalized populations in our city. Minority communities face significant challenges in accessing and maintaining safe housing. Housing policy reform is essential in addressing racial disparities that exist in access to housing and many other interrelated social structures. Justice and equity in our city cannot be gained without access to safe, affordable housing. We know the Housing Department has worked incredibly hard on this initiative, and the policy recommendations are carefully researched, pulling from proven best practices used elsewhere to increase the supply of affordable housing. Increased density, for example, is a sustainable method of development, which allows more units to be built in the same piece of land and which can be designed to fit the character of the neighborhood. This housing initiative is paving the way for creating a fairer and more equitable Phoenix, where residents have access to safe, affordable housing and all the opportunities, health, financial freedoms that it brings, not to mention the benefits to the local economy through job creation. I thank you for your time in considering these vital policy recommendations for adoption.
Thank you for your testimony. Katie will be followed by Sheila Harris.
Good afternoon, Mayor and members of the Council. My name is Katie Aries, and I am here today representing the Arizona Coalition to End Sexual and Domestic Violence. We support this Phoenix City Council's goal of creating or preserving 50,000 housing units by 2030 to complement other city efforts via the policy recommendations heard today. Domestic violence is a leading cause of homelessness for women and children in the United States, and a lack of affordable housing options is regularly reported by survivors as a primary barrier to escaping abuse. According to a statewide survey in 2019, in just one day, 1,539 victims of domestic violence were served by Arizona programs. Among these survivors, housing was their greatest need. While 56% found refuge in emergency shelters, transitional housing, or other housing provided by local domestic violence programs, there was still not enough affordable housing to meet the need. Survivors should not have to choose between a violent home or homelessness. The situation has become more dire with the onset of COVID-19, resulting in substantial rates of job loss, furloughs, and even more increased barriers to resources among survivors, all while eviction moratoriums are set to expire. Safe and affordable housing is an integral component of a survivor's pathway to healing. This effort will help eliminate barriers survivors often face in securing and maintaining safety and independence. Survivors of sexual assault and domestic violence in Phoenix would undoubtedly benefit from this initiative. I thank you for your time and consideration, and with that, yield my time.
Thank you so much for your testimony. Sheila will be followed by Bastian.
Good afternoon, everyone. This is Sheila Harris. I am the founding director of the Arizona Department of Housing and a longtime advocate for affordable housing in our state. I want to take this opportunity to thank the mayor and city council for this wonderful report and this direction that you are taking. I am also here as co-chair of the Social and Housing Advancement Committee of Phoenix Community Alliance. We have 211 members on that committee, and we represent business, nonprofit, neighborhoods, and government all working together to support these kinds of efforts. As you note in the report, the glossary that's attached came from our work and really is meant to provide clarity and reduce some of the emotional reactions people have when they feel emotionally charged words such as affordable housing. It really only means you're only paying 30% of your income for your housing. We want to thank you for your leadership. The Phoenix Community Alliance and the Social and Housing Advancement Committee are here to partner with you, and please let us know how we can help. I yield the rest of my time.
Thank you so much. Bastian will be followed by CJ Hager.
Gallego, members of council. My name is Bastian Androuet, and I'm a registered lobbyist with the City of Phoenix, speaking today on behalf of the Arizona Multi-Housing Association to support the city's affordable housing initiative. The AMA, which represents owners, operators, developers, and over 290,000 rental units across the state of Arizona, would like to thank Cindy Stotler, Sherry Boucher, and the rest of city staff for taking this crucial first step in fostering the conditions conducive to increasing the development of affordable housing. As noted in the Housing Phoenix report, the city currently needs 163,000 new housing units to meet current demand. Considering that only 13,400 units have been built over the past decade, during a period where the city's population increased by over 235,000 residents, it is imperative that we examine the conditions that led to this housing supply shortage and proactively remove those barriers to future development. To illustrate the vast scope of underproduction, at the peak of the state's housing production from 1980 to 1990, the city of Phoenix saw 48,785 multifamily units built. In the following 3 decades, production plummeted, and the city has averaged just under 17,000 units per decade since. This can be attributed to local land use restrictions, onerous design guidelines, height and density restrictions, and perhaps the biggest challenge, NIMBYism, or the not-in-my-backyard mentality of existing homeowners. From Stanford to Dartmouth, Brookings to Cato, and Obama to Trump, one universally agreed upon hindrance to affordable housing development is the imposition of onerous and costly local zoning and design ordinances. As stated by President Obama in his 2016 Housing Development Toolkit, over the past 3 decades, local barriers to housing development have intensified, particularly in the high-growth metropolitan areas increasingly fueling the national economy. The accumulation of such barriers, including zoning, other land use regulations, and lengthy development approval processes, has reduced the availability of many housing markets to respond to growing demand. With that in mind, the AMA would like to thank the council as well as city staff for taking this absolutely wonderful step in the right direction to finally address the true crux of the issue, which is the supply side of the affordable housing equation. And with that, I yield my time and thank you once again.
Thank you so much. CJ will be our final speaker today. CJ, the floor is yours.
Good afternoon, Mayor and City Council members. This is CJ Eisenbarth Hager, and I'm with Vitalist Health Foundation. And for us, housing is healthcare. The connection between housing and health and well-being is clear and undisputed. And as we saw with the analysis presented by Cindy, access to this health-promoting, health-sustaining resource is not accessible to everyone in the city of Phoenix. In particular, folks with limited income and families of color are often placed in a position to make choices of, do they want good quality, affordable housing, or do they want to support other activities in their life? In particular, we want to highlight 2 of the recommendations that we particularly support. While we support all of them, 2 in particular we really want to lift up. The first one is establishing a set of criteria so that when housing development discussions happen, there is a basis for data that discussions can be based upon. And the second one is the use of city-owned land to increase housing affordability throughout the city. We thank the city for joining other efforts to increase housing affordability in Phoenix, including ULI Arizona, health insurers, hospitals, and Phoenix Community Alliance. We stand in support of the city in embracing the tools that it has at its disposal to increase the amount of housing affordability for residents of the city. Thank you.
Thank you. That concludes our public comment from thank you to all of our partners who helped us develop this plan, and equally important or more important will help us implement the plan. Council member comments.
Mayor?
Councilwoman Stark.
Thank you. First and foremost, I want to thank you because I think it was your idea that we should hire someone to really dive into this subject, and we hired a dynamo, that's for sure. She's very well versed. I'm very impressed with the presentation. This is a really important issue, and it does tie into some of the other issues that are happening within our city, including homelessness. So the sooner we can start getting to working on the 8 policy ideas, I think we need to start moving as fast as possible. And if there's any way I can help through our subcommittee, I'm willing to help that. Thank you.
Thank you, and thank you for all the work the subcommittee did to bring this forward. I certainly agree we are lucky with our housing director and affordable housing program manager. I think a very good plan, a lot of different ideas, and perhaps important to us given the city manager's budget update. Many of them we can implement without additional funding since we are in a time period of declining revenues, and we know we have to tighten our belt while the need grows in our community. Let's see. Councilwoman Pastor.
Thank you, Mayor. Really appreciate the presentation. It's really in-depth, and it's a great plan. I have questions for the staff, and what I mean by that, there are the 1 through 9 priorities. In particular, and if you bear with me, I just want to go through some of them. Developing a scoring criteria. I know that developing a scoring criteria has always happened in process. What would be the difference or the change from the past to current? Or is that going to be worked out within the subcommittee?
Mayor, Councilwoman Pastor, and members of the council, we have Alan Stevenson here to talk about zoning specific questions like that one. He has been integral to this plan and putting it together, and I will turn that over to Alan to answer.
Thank you, Mayor, Councilwoman Pastor, and Cindy. The answer to your question, Councilwoman Pastor, is that this area of the plan would be to develop a matrix that would look at various items that you would want to see be present, so that if a multifamily application was coming forward or some application to intensify the zoning, you'd be able to look at that through a lens that is not just what does the individual neighborhood think, or what does a private property owner think is appropriate for that particular property. You would have a matrix that would look at, well, what's the infrastructure in that area? Is there water that's available? Is there access to alternative transportation modes like bus routes or light rail? Those types of things would all be categorized so that as an application would come forward, that would be an additional tool to look at and help evaluate individual requests.
So, Alan, I think that's great, and it's obviously, is it being developed now, or you will convene a group of stakeholders to develop it?
Mayor, Councilwoman Pastor, it would be something that staff would be working with Planning and Development Department staff, Housing Department staff to develop that, as well as our peers within the other departments like public transit and those ones, so we can come up with that, and then we would be able to work with the broader community to solicit some input on that.
Okay, so then item number 2 is about you too, because it says amend current zoning ordinances. And it says zoning ordinances amendments to affordable housing incentives, accessory dwelling units, and expand the walkable urban code. I just would assume in any development, affordable or not, we would be expanding the walkable urban code. And so are you gonna, in the zoning piece, as you talked about the scoring, is that where you're gonna try to incentivize affordable housing?
So, Mayor, Councilwoman Pastor, these other items are separate and distinct elements in and of themselves, because the matrix that we just talked about would be something that staff would work on developing with the community and council input, and then be used throughout the city, where we would be targeting specific amendments, for example, in affordable housing incentives. Right now, the zoning ordinance has incentives to get additional density in residential projects if you meet certain criteria, like providing additional open space or providing some artwork and other amenities. You can earn additional density bonus in doing that. What we would propose is to amend that part of the ordinance to allow for affordable housing to be developed and get additional density associated with that if you were doing affordable housing project without have, just meeting the criteria in order to do it, instead of an individual rezoning case to ask for more density.
Okay, I understand what you're talking about. And then item 4 says an increased funding. My understanding is that there is a group already working on affordable housing, a group of developers, and they're putting money into, I'm not sure what it's called or named, but they are putting, they're incentivizing and putting money in to develop affordable housing. Is that part of developed alternative financing?
Mayor and Councilwoman Pastor, members of the council, yes, there are a number of groups that are currently working on affordable housing funding mechanisms. The Affordable Housing Fund, I can't think of them all the top of my head, but there's a healthcare group led by United Healthcare that is putting some of their community reinvestment funding out of access. It's an access requirement for those healthcare facility or healthcare organizations that work with access have to put a certain percentage of their money back into the community. They are identifying a percentage of that fund from each healthcare organization to put into a large fund that they will then try to create and incentivize affordable housing, including permanent supportive housing for chronically homeless. There's also another activity going on via the Sheila Harris's group that she mentioned, where the business community is asking for a transaction fee on every property sale. And I think there's a different fee for commercial and residential, but it's a voluntary fee that you pay. And in that way, they're trying to grow also another affordable housing fund so they can provide low interest loans to create more affordable housing. So one of our recommendations was to harness some of this excitement and activity going on in the private sector around affordable housing and try to bring those folks together to make sure that we can all work together and leverage all those funding mechanisms to create affordable housing in the city where we want it in areas of opportunity as we spoke about.
Okay. I pretty much can understand all the other points. My question to you, Cindy, is this going to be worked out of a subcommittee and then recommendations brought to us? Or how is this going to be brought forward again? Because this is a lot of pieces and a lot of chunks, and I believe that we need to move quickly on this because I feel like we're in a crisis, but we also need to be mindful and prepared on how and what we write in policy and then how it rolls out in real life, I guess. And so my question is, how is it going to come back to us, or it works through subcommittee? And then my second question is about Davis-Bacon and prevailing wage, because there was a statement made earlier on costs for affordability. And my understanding is prevailing wage does not affect affordability. So question 1 and question 2.
Mayor, Councilwoman Pastor, members of the council. So we are anticipating that housing will continue to lead and implement the Housing Phoenix plan. Sherry was hired as a permanent employee. She will stay with us and lead the efforts to implement these initiatives that we've recommended today. But many of the initiatives require different procedures and they have ways of coming to council, like the Allen's zoning amendments will have to go through the normal process to create a text amendment, so that will have to go to the village planning committees and the planning commission and the council. So every one of these probably will take a different action from the council. We technically work through the land use and livability subcommittee, so I imagine that most of these recommendations will be coming back through the land use and livability subcommittee and then go to council for implementation. Regarding the second question on Davis-Bacon wages, Davis-Bacon wages are required on all federally funded projects. We actually, in the housing department, we regulate Davis-Bacon. I don't know, I'm losing a word here. It's been a long presentation, sorry. We monitor, there we go. We monitor the paying of Davis-Bacon wages for all of our federal home fund loans, all of our project-based voucher, construction, and any other loans that come out, community-based, community development block grant as well. So anyone who gets a loan from the City of Phoenix Housing Department, and they include federal funds, must pay Davis-Bacon wages. That's a federal requirement, and we monitor that and report on that. So that is the extent of our involvement in Davis-Bacon. We do know that it depends on the economy, whether Davis-Bacon is a higher wage than what we are paying in the market. And during the recession, Davis-Bacon was a much higher wage. But I think currently, lately, with the housing construction going on, Davis-Bacon may be equivalent or maybe even lower than some of the prevailing wages. So it just depends on the economy. Not sure if I answered your question, but that's our involvement with Davis-Bacon.
Mayor?
Councilmember Garcia.
Thank you. I know Councilwoman Pastor, I saw you were talking, you were on mute. Were you done?
I'm sorry. I'm sorry. Yeah. I was just saying that my understanding, prevailing wage has a net zero effect on affordable housing. So we can talk about that later, but I just want to put that on the record.
So I don't, first of all, once again, thank you. Really impressive, and glad that we're taking this on, especially at this moment. I had a couple of questions. I'm just gonna ask them all, and then, so I guess this one's for Alan. On the zoning ordinance, does it mean that we're gonna create a separate set of rules for affordable housing? Meaning, are we gonna expedite things? Are we gonna make it more accessible? Just give us, I know we still have to figure this out, but just an idea of what it would actually look like. I think this would be imperative to make sure that we could get affordable housing moving. So just an idea of what it would look like.
So, Mayor, Councilman Garcia, it depends upon which item we're actually talking about as part of the plan. So the plan has text amendment items. Those are the ones that are really outlined under number 2. But then it also has some other ones that are more how things can be allocated within the department. So one of the ideas that Cindy talked about is having a team that would work on affordable housing projects within the Planning and Development Department to help streamline things. The team leader, much like we do in downtown, we have a team leader who just focuses on downtown projects because of the unique nature of them. We would do that so that all affordable housing projects would go to that one team. They could become familiar with all the requirements, help streamline things as much as possible, and we think there's some real time savings there that will help projects move forward. That doesn't necessarily take any additional money to do that, and it doesn't take a significant work with the community to make happen, because that's really an allocation of resources within the department that we're willing to do and balance with our other customer needs. But that certainly is a very good initiative to start sooner rather than later. The other ones are going to have to be worked on a case-by-case basis. So for example, we talked about the affordable housing incentives that when Councilwoman Pastor talked about a few minutes ago. It would not be a separate part of the ordinance. There's already a part of the zoning ordinance that talks about how to earn density bonus. As part of that, it's principally focused on additional open space or improvements to that open space like tot lots and other things that are over and above to earn the additional units. And sometimes projects will prevail and use those, but they're not used that often. What we would try and do is modify that part of the ordinance to create greater incentives for people to do affordable housing projects, and it would be something that would get them additional density without having to go through and rezone to make that happen. But we would still be ensuring that they're meeting the same type of quality development standards that every other project would get. It would just be that if they were providing a certain number of affordable housing units or providing an in lieu cash contribution that could go to a housing trust fund to do some of these things on a broader scale, that they could earn that additional, density within their individual project.
Thank you. And I think back to Cindy, I have a couple more questions. One is, I know a lot of this work has a relationship to federal programs, federal credits. How we're going to be working both developers, organizations to make this happen. Second question is, we saw a lot of images from organizations such as Native American Connections and folks doing great work. And I know your relationship with them is reciprocal. You already support each other. What are some of the examples or ways in which they're going to be included in the program? And then finally, is there going to be a matrix or a certain percentage that we as a city are going to designate as anything below this is affordable housing, anything above this is not? Does that make sense? Just to kind of assure that we're all in the same understanding of what affordable is.
So Mayor, Council Member Garcia, thank you for the question. We do have wonderful relationships with our affordable housing developers, and the outreach that we did with them during this process fed into a lot of these recommendations. These are the things that would help them create more affordable housing. Some of the barriers are in planning and development. The development process is complicated, and they have federal timeframes and requirements that they need to meet, and having the development team was their number one request to assist them through the development process. The other major barrier that we heard from developers was NIMBYism, and that is prevalent. You heard that from the Arizona Multi-Housing Association. So that's market rate and affordable housing has issues with NIMBYism, and that is why our first recommendation was to create the scoring system to be able to objectively evaluate these requests as they go through the zoning process and have another alternative to look at and evaluate in their decision-making process as we approve zoning cases. And then the third last barrier is, the barrier to many things, which is financing. There are federal low-income housing tax credits available. The state runs that process. The State Department of Housing runs that process every year. It just doesn't create enough housing. There's not enough federal low-income housing tax credits to go around. It's a very competitive process. We maybe get 2 to 3 projects in Phoenix a year out of that process. Maybe 500 units a year. So that's not going to get us to the 99,000 units of affordable housing that we need. What they really need is they need gap financing, which we do with our home funding and all the other federal pass-through funding that we have. But the gap funding goes into the low-income housing tax credit process. So if they don't get a project awarded, they can't use that. So we need alternative funding mechanisms, and that's really where we hit the public-private partnerships, looking for alternative low-interest financing and trying to find investors that are investment groups or banks that are willing to take the chance on affordable housing and provide the non-federal loans that they would need to create housing without regulations and to move quickly. So that's part of that whole, engaging the public and the private partnerships together in the group or task force that we talked about, trying to find ways of finding that financing and alternative methods of getting this housing built. I think that addresses your first questions. And then can you repeat the last question? I'm sorry.
What are we going to use as the marker for what affordable housing is? Is it a percentage of is there a number we're going to say this is affordable housing, this is not?
So that's a really good question, Councilmember Garcia. We hadn't thought about a label because, as we said in the study, affordable housing is particular to you. Your household composition and your income tells us how much you can afford. But when it comes to federal affordable housing, that means that our affordable housing is affordable to people at 50% or below area median income. So we call that affordable. If they're on a Section 8 voucher, we call that affordable. I would have to go back and consider that if we're going to go forward with identifying certain units at certain rents as affordable, because it just depends on the family size, the household composition, the income that they're at, and also the market at the time. And I'm sorry, I don't have a solid answer for you on that one. We'll have to come back and maybe discuss it in a further meeting.
All Thank you. And then the last question, and I don't know if this is for Ed or for who. A lot of the comments today and a lot of the conversations centered around what's happening with COVID and the new kind of situation we're in, knowing that a lot of folks might be in a situation where they need affordable housing. Is there a possibility that some of the CARES funds can help part of this plan kind of move quicker, or can we support it in a different way, knowing that we're going to have to directly respond to the housing issue because of COVID?
Mayor, Councilmember Garcia, thank you for that. I think the key, there's two keys for CARES funding, and one of them I think will be obvious. The one is that it has to be directly related to the COVID-19 pandemic or the economic downturn because of COVID-19. So the fact that we've had an affordable housing issue in Phoenix for such a long period of time would work against that. But the second piece is that we have to spend that CARES money by December 30th of 2020. And I think as we see, affordable housing is a very long-term effort. But if there are specific pieces related to affordability and the impacts of COVID, we can certainly look at that. There is still a little bit of money left to allocate by the council. So we can look to find ways to be creative with that to the extent that it's related to COVID and it can be accomplished by December 30th of this year.
Thank you.
Thank you. Councilman DeCiccio.
Thank you, Mayor. One, I want to congratulate Cindy for doing an incredible job over there at the Housing Department while she ran it. You did an exceptional job in some very difficult situations. I also want to echo what Councilwoman Stark said about Cherie. She's just doing an amazing job there. She's bringing forward, I think, one of the more comprehensive plans we've seen on anything that we've done at the city. And so it's a market-based, a lot of it's market-based. And because of that, you take a look at what's really happening out in the economy. It's hard to force issues when the market's going contrary to you. So I like that a lot. One of the things I would hope that we would look at when we're talking about affordable housing, and if we do put together a committee, I think we need to have people that have different ideas be on there as well, rather than the standard, let's go build another apartment complex that's out there. And one of the people I'd like to recommend that we look at is Elizabeth Singleton. I mean, she has been a leader on the tiny houses, trying to bring that to the city of Phoenix. I think that is a good move. It's something that brings in a new and, like I said, creative way of looking at things and look at housing. So if we do put together a committee, I'd sure like to see her on there. I think we need to start looking at alternatives that are out there and have everything be on the table. It's always easy to say, well, this is what we've done in the past, let's do more of it, when in fact something like this could provide the type of affordable housing that we need in the city of Phoenix. Some other states are moving toward this, but it's difficult because it's always something different. But I'll tell you, that lady is a go-getter, and I'd love to see her in one of our committees. Thank you, Mayor.
Thank you. Any additional council member comments?
Mayor, this is the city manager. I just wanted to add one other piece back to Councilmember Garcia's question, and Ms. Jonovich reminded me. One of the things indirectly that the CARES money might help us with is it could free up some of our CDBG funds that are not CARES related, so that we can spend, if we're spending some CDBG funds on CARES issues, we can switch that over to CARES money, CRF money, and that would free up CDBG, which is a long-term funding stream that the housing department uses. So there are some ways that we can look at that. I know Ms. Stotler and her team, Jeff Barton and the team from Neighborhood Services are looking at that. So I just wanted to add that piece as well to Councilmember Garcia's question.
Thank you. That is very strategic. We'll go to Councilman Nowakowski and then the Vice Mayor.
All righty. Well, thank you, Mayor. Mayor, once again, I want to thank Cindy for your plan, really looking at the housing need in the city of Phoenix. It's way due. the gap analysis. Thank you for providing that. And looking at future development sites within the city of Phoenix and city-owned property, and creating these ideas of policy recommendations that we have to do to make sure that we have affordable housing and that we provide it throughout the whole city. You know, one of the things that I liked what you talked about was also coming up with creative ways of looking for outside funding. I think that's one of the big things that nonprofits like Native American Connections, CPLC, and other nonprofits that build affordable housing really need, because they're stuck with federal guidelines, and sometimes they tie your hands and it's not affordable when it comes to that. The other thing is really looking along the light rail in South Phoenix, along my district, right down Central Avenue. What I'm afraid of is that if we don't create some type of affordable housing and mixed use, and I think that mixed use is really the trend when it comes to workforce housing, affordability, and making sure that people that lived in those neighborhoods and graduated from the universities can come back and live there. I don't want to see the gentrification that we've been having in the downtown area, and even in the Garfield area and stuff like that happen in South Phoenix. So this will be a way for us to make sure that there's affordability, workforce housing, and then mixed housing along that light rail. So I want to thank you all, and thank you for creating that matrix. I really think it's important to have a matrix so that we can follow these guidelines and make sure that everybody's dotting the I's and crossing those T's. Thank you so much.
Thank you, Vice Mayor.
Thank you, Mayor. Once again, Cindy, thank you so much. That was amazing. All the great work and the hard work that you guys have done, I really love. So appreciative and honored to be part of this council now when we're having these type of conversations. Also, big thank you once again to the mayor. Thank you, Mayor, for your leadership and the great work and putting this at the front and making sure that we're able to come up with solutions for this. And then also wanted to take a moment to thank Sheila Harris for getting on the phone and for your comments. I know that you've been a huge advocate for housing, at least in our district. You've been present at our meetings. You've been talking about this. Thank you so much for bringing awareness to this. And once again, want to thank the whole team for the effort and for everything that's being done on this issue. Thank you, Mayor.
Thank you. It is exciting, the great partners who are willing to help us tackle such an important problem. 50,000 units by 2030 is an ambitious goal, but responsible, and the city is up to the task for addressing important challenges. Any additional council member comments before we vote? All right, roll call.
DeCiccio?
Yes.
Garcia?
Yes.
Nowakowski?
Yes.
Pastor?
Yes.
Stark?
Yes.
Waring?
Yes.
Williams?
Yes.
Guardado?
Yes.
Gallego?
Yes.
And Mayor, that motion passes unanimously.
By a unanimous 9-0 vote, the Phoenix City Council has approved our ambitious affordable housing strategy. Thank you so much. 50,000 units by 2030, here we come. That is our final agendized item for today's council meeting. We will see you again tomorrow. We are adjourned.